I'm Dr. Tok Hussain. I'm Deputy Editor of the Occupational Medicine Journal. Welcome to this video introduction in which I give you a brief introduction to issue 6 of volume 65 of the journal. In this issue of Occupational Medicine we have a number of papers particularly relating to the health of doctors and relating to occupational health matters in the UK National Health Service. This is topical at the moment as the General Medical Council have recently published the findings of their review of doctors who commit suicide under fitness to practice investigations document, and this document revealed that poor communication is an issue for doctors. This links into the paper written by Debbie Cohen and colleagues, which looks at exploring the obstacles and enablers for doctors returning to work after long-term absence. This paper reports that communication is the main obstacle for doctors returning to work after illness. A further paper in this issue from Spain, written by Braqueje et al., explores and compares the profile of psychiatrists who are part of the Barcelona Physicians' Health Programme, and this paper reports that psychiatrists are often more reluctant to ask for help than other physicians. Further on in the journal, a thought-provoking paper by Professor Sensky et al. Examines chronic embitterment in NHS staff, a theme all too frequently seen in our occupational health clinics. Professor Sensky also discusses this research and discusses embitterment syndrome in the latest Occupational Medicine podcast, which you can download from the Occupational Medicine Journal website or on iTunes. There are then 3 further papers in this issue which continue the mental health theme. Sarah Jones et al. Explore the possible relationship between the implementation of the NICE guidance on mental well-being by NHS trusts in England and mental health outcomes as reported by their staff. No clear, definite relationships were found between the implementation of the NICE guidance and self-reported mental health outcomes, although the authors do go on to postulate on the possible explanations for this. A paper in this issue by Revellier et al. Investigates the use of the Health and Safety Executive Management Standards indicator tool in evaluating employee engagement at work, and a further paper written by Acquadro Maran in Italy looks at stress, anxiety and coping strategies in Italian police officers, finding that there are higher levels of stress reported in female officers, non-commissioned officers and in patrol officers. As well as psychological hazards, physical hazards are of course an important part of occupational morbidity. In this issue, Malik and English look at the important subject of contact dermatitis in healthcare workers, confirming that irritant contact dermatitis is common in healthcare workers with a reported prevalence of around 4%. A further fascinating paper looking at silicosis and autoimmune disorders is published in this issue, written by Streichman et al. This paper focuses the mind on the importance of occupational health surveillance and screening. A further paper by Daman et al. Reports disappointing results that employees in the construction industry in the Netherlands are ambivalent about preventative health checks and health screening. Audit and peer review are very important parts of clinical occupational health practice that physicians are required to participate in as part of their annual medical appraisals. Finally, in this issue, the paper by Lalou and colleagues shows how a simple audit and peer review process can improve the standards of occupational health reports. I hope you have enjoyed this video podcast of the latest issue of Occupational Medicine, and I hope you enjoy reading this issue.